past few weeks, we've been getting reports of, increased cases of cough, catarrh, malaria, or malaria-like, symptoms and all that. What do you know?
So there's some things I call rule of thumb in current medicine in our parlance, in our locality. If you have malaria that doesn't respond to malaria medication, you probably are dealing with COVID, number one. Number two, in this particular wave, and this I think is maybe the effect of the Omicron variant as a part of the coloration of this current wave, it's a very, very fast transmitting variant. But I dare say it's a much more benign variant. It isn't as hard hitting as Delta was, the last one. So for example, when I look at, I'm part of an organization that does community testing. So we test people, pretty much everyone, well or not, for a particular group of people. And the numbers are ridiculous. It's 15%, 16% of the entire population are popping up positive. However, the wards are empty. So they're asymptomatic. They're not really sick. It's a sniffle, a cough here and there. Oh, I feel a bit tired today. 2-3 days, they're back on their feet and all of that. Seems to be the more prevalent way this one is expressing.
Yeah, so we have people 2-3 days, they're back on their feet. 2-3 days later, they're off again. So
that pattern is a very COVID-like pattern. So it waxes and wanes, and then sometimes you're left with some kind of fatigue that you almost can't explain. You think you're okay 1 minute, and then you're like, I need to just be in bed. The fatigue is a very key part of the component of the symptomatology for COVID.
So a friend of mine has something like that, and we went to the hospital, and they said, I told the person, I said, I think you have COVID, test for COVID. And the person went in to see the doctor, came back and said, the doctor says it's malaria. The test has been done. The result wasn't out though, but the test had been done. And it didn't sit well with me.
I know. I think part of the thing is just coping with our reality. We still have severe limitations for testing in country. I mean, River State is a bit blessed. We've got the government facility that's able to test. We've got the private labs. We've got, around the state and all that being a bit obeying as River State is or Port Harcourt is. But that's not the case in most of Nigeria. And even in River State, it's a bit, so imagine you walk into a center, for example, and you say, oh, I can't feel okay. I don't feel all right. Can I test for COVID? It doesn't work that way. So you have to get out of there. You have to go to the centers, either the one there, Paul, or you go to the one at BMH, or you go to the one at UPTH and all of that to get there. Or the private one is about 35 to 40 grand the test. So it's a lot to get into that.
35 to 40 grand, that just rules out like 99.99% of people
won't be able to do it, or we won't see the need to do it even if you could afford it.